Okay, so good evening, everyone. Welcome to Get Inspired TDR Global Asia Women in Science webinar. My name is Agitiara and I'll be your host for today's program. Today, we're very honored to have with us Dr. Razia Fatima, the technical consultant for TB strategic planning and global fund application at UNOPS and a remarkable leader in global health research. This session is brought to you by TDR Global Asia, a community that connects and supports researchers to strengthen research capacity in low and middle income countries. So, before we start today's session, let me introduce you our esteemed speaker today. It's Dr. Razia Fatima. She is a leading Pakistani physician and epidemiologist whose passion for tuberculosis control transformed her from a rural medical officer into a global health leader. Amazingly, she led Pakistan's national TB surveillance and research initiatives and now advises the United Nations Office for Project Services, or UNOPS, on TB strategic planning and global fund grant application. As chair of the Union Ethics Advisory Group and former head of its TB section, she champions ethical research and training programs while co-founding Health Solutions International to address broader health and socio-economic challenges. Her excellence has been recognized with the Union Medal in 2024 and acknowledgement among WHO TDR's top 10 women scientists. So if you're interested to know more about Dr. Razia Fatima, you can see the in the bottom right, we have a QR code that you can scan with your phone, and it will lead you to her TDR global profile. And some of you might have already been familiar what is TDR Global Profile. So we have TDR Global Discovery, one-stop solution, our a social media for our researcher and experts. So if you're looking for an expert, if you need a multidisciplinary team, if you want to share your knowledge and your achievement, or if you're requiring some additional exposure for your work, you can visit the TDR Global Discovery Platform. It's a public database of people who have received funding, serve as experts on committees, and who have been involved with TDR partnership over the last 40 years. You can kindly scan the QR code below. And as before we begin, a quick housekeeping note for us all. Please stay muted unless you are speaking, or you can just raise your hand and use the chat box for questions and reflections. Feel free to send a chat using your chat feature. You can find it on your Zoom control screen. And we encourage you to turn on your camera during discussion, if possible. It makes our session more interactive. We, we are very happy to see where you are. And if you want to drop your name and where you came from, so we can say hi to you, please feel free to do so in the chat box. So let's officially begin our program today. We have Dr. Razia Fatima here with us. Hi, doctor. Good evening.
Hi, good evening. Thank you very much, Agi, for a very nice introduction. I'm very humbled and I'm very pleased to join you today. So, should I start?
Yes, the
Okay,
screen is
I
yours.
just, okay, thank you very much. So, I'll just share my screen. Okay, are you able to see?
Yes, we can
Okay,
see.
great. Okay. So, thank you very much once again to TDR and Global Asia team. So, today's topic is, as you all know, Get Inspired Resilience Research and Women Leadership in Global Health. So, what I've done is that I have tried to explain my journey to all of you. And in between, we will discuss as well, try to make it more interactive, and I'll try to answer your questions as well. Please, if you have any questions, do write them in the chat and then I'll try to respond. So let's go to the next slide. Okay, Yeah, can you see the slides moving?
Perhaps you can full screen the slide, Doctor?
Okay. So are you able to see?
We're able to see.
Oh, okay, great. So this is my career highlight, starting from my medical degree from Pakistan in 2001. I did my MBBS from Frontier Medical College, Ahmedabad, which is one of the province which is very well known for good universities and medical colleges. So from there, I did my MBBS, which is the medical degree called in Pakistan, and I did like I was from the beginning. I was a topper, so I did had two gold medals, one as a best graduate from the medical college, and one as overall topper in the final year. So after that, I was appointed, like after my house job in a hospital, polyclinic hospital in Islamabad, I was appointed as medical officer in a remote basic health unit. So let me tell you, this was my choice to join a remote basic health unit because you know once you're young and you're a medical graduate, it's up to you to decide where you want to go. So when I did my medical, I was with the passion to serve poor people, and that was a golden chance for me to serve that in a basic health unit where there were very limited services available at that time. So I'm talking about 2002. And at that time, it was like there used to be one medical officer, then some of the lady health workers, then one vaccinator, some outreach staff, and also some antenatal care and LHV. So you see, this was very basic. But what I was observing in that, in my tenure in that health facility, that I observed that many patients were coming with cough of more than 2, 3 weeks, and they were having symptoms suggestive of tuberculosis. And I was really trying to understand what is going on. I was not a researcher at that time, but I had that inquisitive mind, and also I had an interest to work for tuberculosis. So I requested my DHO office, which is the district health office, to send one microscope to my unit. So at that time, for TB diagnosis, mostly microscopy was done. So there was no gene expert like modern diagnostics right now. So I had those equipments in my health unit with the help of, with the support of the district health office. And then I see a lot of patients coming and diagnosing and also registered in the same BHU. So that BHU was then converted to a model dot center after a period of 2, 3 years. And then I used to have a lot of international missions. So this is where was my turning point. So this is important to mention for all of you that some it's usual to have a turning point in your life when you are inclined towards a career. So at that time, when I thought, okay, now I should pursue my career as epidemiologist and as researcher, and then, luckily, in that basic health unit, I had a visit of DG, Director General WHO, at that time, who was John Woke. So he visited and he was very impressed, and he offered me a scholarship to do my MSc epidemiology. So this was one of the first of its kind. I did my MSc epidemiology from London School of Hygiene and Tropical Medicine. And while I was appointed as medical officer, so then when I completed that in 2008, then I decided to join the National TB Control Program, which was again because of my interest in tuberculosis. So this is how I started. And then within the National TB Control Program, I completed this degree when I joined, like just before joining, I completed that. And also, when I did that, I thought that I should have a master's from Pakistan as well. So I did Masters of Public Health from Pakistan during the same time. And then in 2015, I did my PhD, which is PhD in Public Health again. I decided to pursue it as, again, the following the same to assess the missing TB cases in Pakistan. So I will tell you in detail that how I thought about doing this PhD because there were a lot of missing TB cases in the country when I saw statistics and everything. So luckily, in between 2009 and 10, I also did a structured operation research training. So this is how this is important for all of you to know that you get opportunity maybe from God that you pursue your career and you pick that. So what happened that there was a call announced for SORTED, Structured Operation Research Training Initiative, in 2009 and 10, and I applied for that. I was selected. So my mentors were Tony Harris, Professor A.D. Harris, and Don and Arson, who were very well known in the field of tuberculosis. And my batchmate was Dr. Ajay Kumar. So what we did was we completed that 1 year, and I decided that I should have the same course in my country. So that was also a long struggle for me to have the same course, because, when you are trained in something which is of international importance, which is a research, and then you want to implement in your own country, obviously you have to think about resources. You have to think about how will it be successful, how you will get good candidates for that course. So this was all things in my mind. But fortunately, there were a lot of positive support from my program, from the leadership, from my colleagues, and I was able to launch this in through National TB Control Program in 2016. So that was part of the success story. And so you see that I led and organized sorted courses in the country from 2016 till the COVID period 2020. Then there was some break because of the COVID, and then because of some financial challenges, it was then halted. And now again, I have launched the same course. Right now there is a second cohort that is announced. So I'll tell about this course detail as well, so that if some of you are interested, please join us in that course, because it gives you a high level training in operational research. And if you are interested in doing research and publications, right now I'm author of 100 plus publications, which are published in international peer review journals. So if you're interested, you should join that, and then have your publication, dream come true. So after this 2017, so I did my PhD, completed, then Sorted was launched, and then there was an opportunity to have a promotion as Chief of Data and Research. I applied to that position, and then I was promoted based on my qualifications and credentials. So I continued with this Chief of Research and Surveillance at the Common Management Unit for TB, AIDS, and Malaria. And also there was another hat, which is an honor for me, which was that I was selected as chair of the TB section. And I was also co-chair of the Ethics Advisory Group, which is the International Union Against TB and Lung Disease. Sorry. So in 2024, I applied for a highest position, which was the national coordinator, and I was selected based on my qualification and experience. So I was looking at program overall in the country, in all the provinces, and I was a national coordinator at the Common Management Unit. So right now, as Agi has told you, I'm the technical consultant for TB strategic planning and global fund grants application. So at each point in time, at each cascade or at each level, you find a story, which is a story of, again, a story of having a passion and also resilience. And I'll tell you the challenges I faced, but still I continued the journey. Okay, so as I said, resilience in global health is very important, and I'm sure all of you have experienced this. Some of you must be in the beginning of your career, and some must be in the mid, or some may be the experts. So overcoming systemic and operational challenges is very important. So as I told you, that leading TB control Pakistan was not easy. Also, I was given this opportunity by my colleagues and by those seniors who were already within the program, that I should submit grant for TB Control Pakistan. And I was able to secure this grant with the help of, obviously, all the colleagues and the international consultant and the national consultant. So, and the grant is secured till 2026. So I feel pride that I had a very significant contribution in that grant. And there was a whole cascade of activities, like once you do epidemiological review, then you do joint program review mission, then you start preparing this national strategic plan, and based on the targets that are set by the provincial, on the basis of provincial demands, then you submit grants. So this was a whole process. And you see, when I talk about TB control in Pakistan, so it is challenging because we have a high disease burden, and must be true for like the colleagues from joining from Indonesia and Philippines. So our disease burden is right now, it's like 686,000 prevalence and 447,000 mortality, with 475,000 notifications. So you see, still we are missing 200,000 TB cases in the country, which pulls up every year. So this is the point of concern for us, We really need to have out of box solutions. We already have tried many interventions and we are able to have a very high notification. This is a success story for the program, but obviously we have to do more. So maintaining program momentum despite frequent funding cuts. So right now, as we all know that there is funding freeze because of the USAID. So similarly, there was a situation like this, that there was funding cuts in the past as well, and there was inadequate government finances and the slow releases. So there's a complicated process within the government. So they do try to put in resources, but the process is different from the donor finances. So we face this challenge of slow releases. And of course, the workforce shortages as well. Once we train, some people leave, and then, we are left with non-technical people, and then again, we have to recruit. So these challenges are very normal in all the programs. So another success I want to quote is the resilience in the global health emergencies. So when the COVID came, so COVID gave me especially a great lesson, because in that time, obviously, we were working remotely. There were some smart lockdowns, and then there was an opportunity given to Pakistan in the form of C19RM, which is the COVID-19 response mechanism funding. And I was fortunately leading that call with the national coordinator at that time. So we were able to secure some very good interventions, funding for the very good interventions like genomic surveillance, like infection prevention control. And recently, I'm very proud to see that some of these interventions were completed very successfully. So adapting strategies to sustain essential services in COVID-19 was very, very important. So this also gives us a very good lesson. Also, there are many innovations that I, with the help of other colleagues, have tried to implement, which was the digital tools. I will talk about it later. Telemedicine was very interesting, where we established a system of tele-echo, where we used to give some very good presentations, and we used to invite the physicians or the GPs who are engaged in tuberculosis or HIV to come, to log in, to register, as you have all registered this webinar. And then we usually discuss the case study or some of the academic slides with them. And then there's a very good interactive session at the end. I really enjoyed that. So this is one of the success I want to quote here. Also, patient-centered approaches when in-person services were disrupted. So this is all went hand in hand. So please, anything which is unclear, you can ask, and any burning question you want to ask, we can stop and then discuss it.
Okay, doctor. So we have questions in the chat.
Okay.
Uh,
Yeah.
Amira Bafadel ask how we can engage with global research work with you, Dr. Razia, in NTDs.
In NTD.
Yeah.
Yeah, sure. Sure. So thank you for your question. So we can engage in entities, and I will talk about our this initiative as well, that we are doing some work in entities. Especially recently, we have done some work in cutaneous leishmaniasis, and also we have done some meeting at the national level where we discuss this emerging new disease, including entities. So I want to say that please write me an email and discuss with me. I think you're going to share again my email with them, so we can have a sorted, structured operational research dedicated to entities. And if you want to engage me in that in any of your project, then we can help you out for that as well. I hope I've answered your question.
Okay. Thank you, Doctor. To Amira Bafadel. Hopefully it
Yeah.
answers your questions. I asked permission from Dr. Razia Fatima to share the email, your
Yeah,
email in
sure.
the chat room.
Sure.
Also, I noticed a very interesting point in your
Mhm.
presentation.
Yeah.
When you say we need to maintain momentum, program momentum during all these budget cuts, and we all
Yeah.
know, Doctor, recently there's a lot of budget cuts here and
Yeah.
there and everywhere. I think most of us here had already experienced some of it. How
Yeah.
how did you manage? Perhaps how did you manage the team? How did you manage the project? And how did you
Hmm.
manage your research expectations?
Yeah. So this is a very good question. So I want to say that obviously, resilience in every field is important, but when it comes to funding cuts, this is more important to keep yourself motivated. So obviously, as a consultant role for me, it was a bit different, and of course challenging as well, because when you are getting finance from somewhere and then all of a sudden there is cut in the donor finances, then you have to think about the alternate ways. So I tell you, the success story is that in the same period, we launched the structured operation research training. And I want to congratulate and I want to I want to applaud my team that they told me, and I don't know if they are in this webinar or not, but they, when I asked them that okay, we are with a very short finances and probably we have to cut our budget very short, and if you were used to have a lot of per diems for these trainings, I'm sorry to say that you will have to do this free of cost, either free of cost or very minimal amount which is available. And then they agreed. So this is the story of passion and motivation. So if you have some passion and motivation to work, then you can continue. But of course, it is very difficult because you have to meet all the expenses that are already planned. But then I was also very lucky to have support from universities as well. So one, support from colleagues who are with me in that initiative, and also support from the universities. So this is how I managed, to continue the momentum in research.
Well, thank you so much, Doctor, for the insight and the answer.
Mm. Yeah, thank
Perhaps
you. So
if there's any more questions, everyone can type in or just raise your hands to speak and to speak in the
yeah,
forum. You may continue,
okay.
Doctor.
Okay, so I continue with the slide. So next slide is again resilience in the global health. So as a woman leadership, I want to mention it as a specific story because in Pakistan, as in other LMIC countries, it's very challenging for a female researcher to suddenly come in and say that, okay, I am trained in research and I want other people to get trained in research. So this idea is not very well welcomed in a male dominated kind of culture. So this is what I faced, and I want to mention here that navigating this male dominated health in the health leadership spaces is very, very important. So I'm very proud that people quote me as a role model for the woman scientist and leader. And I'm very thankful to WHO TDR for supporting me and for having feature of my success story around the world so that people can, refer back to these stories as women scientists. So when I launched this structured operation research training initiative in the country, there was very few female researchers, Number one, there was a resistance, obviously, which is very normal in all the institutions that if only one or two women are there in whole program, obviously and then suddenly they talk about research. So it becomes alien for everyone else who talk about project and anything else. So in a program setting to launch research environment was challenging. And then when I had this, sorted course launched, then I was having more response from female researchers, which was very much encouraging for me. So initially it was like 60 to 40 percentage and 80 to 20. And then now the opposite of like I'm having 80% female researchers in every course and 20% males. So I would say that it's a paradigm shift that I have observed over the period of time, and advocating for the gender equity and mentorship while managing the technical and political challenges. This is very, very important. So for all my female colleagues who are in this webinar, this can be a motivational story for you that please don't forget about it if somebody says that this is not for females. So nothing is like immune or nothing is like impossible for females. So if you have a vocal and have a strong will, strong voice to do anything for tuberculosis and especially in research, so you can do it very well. So this is one of the important thing I want to mention. Then sustained impact and despite barriers. Again, over 16 years in TB and continuously driving progress is not easy, because of many challenges. As I mentioned, gender related challenges, political challenges, and sometimes there are institutional resistance as well. But once you are with the passion and you know that you can succeed and you have some qualities to deliver, then I think you can deliver it very well. So there was a visible progress in the detection, treatment, and prevention for tuberculosis in the country, which was appreciated by many donors and our colleagues in the country. So consistently delivered outcomes, and as I said, even there were bureaucratic and institutional resistance, but still the targets were achieved, which is a success story for me. And not only for tuberculosis, when I joined as national coordinator for TB, HIV, malaria, HIV was a big, challenge for our country because obviously we were trying to have a reliable estimate for HIV in the country, and then because of poor infection control, there were many outbreaks that were reported to the program. So it was very important to have a close coordination between TB and HIV, also for HIV between provinces, because in Pakistan there are further challenges of devolution. So I would call it as challenge and opportunity. So devolution means that provinces are also kind of independent. They have their authorities. So we have to respect their authorities and we have to go and talk to provinces, have their demands or have their, inputs for when we make budgets and also when we plan for something for the future. So similar was, I did it for TB as well, HIV as well, and malaria. So the corresponding provincial colleagues or provincial counterparts, they were engaged in the high level meetings to plan whatever activities we were doing for TB, HIV, and malaria. So, as I said, I was also lead for the submission of TB grant. So, this is also a success story for me. So, as a researcher, translating evidence into impact was very important. So one is that you do only research. So I had, as I said, I have 100 plus papers, and it was very difficult to put in slides for those papers. So if you're interested, please go on my ResearchGate profile and see all the papers. They are on the TB detection, prevention, not only the sensitive TB, but also the MDR TB. You will see some interesting papers on HIV and malaria as well. So for me, it was very important that all my researches, whatever researches I've done through Sorted or other initiatives, they should have a positive impact and they should have some policy changes. So I was involved in many countrywide researches. This includes the TB prevalence survey, the TB inventory study for children. So this study, which is called TB inventory study, this is like called as parallel to the survey. When we cannot do survey, then we do this inventory study. And what we do is that we establish a surveillance system in the country. We map the facilities that are reporting to the program. We also map the facilities that are not reporting, and then we establish a surveillance system. And the end, we compare these sources of data and we come up with underreporting. So with the adult TB inventory study, it was very difficult for me to change. Like it totally changed the estimate for the country. We used to say that 70% case detection, but after that, that was quoted in the WHO TB report because of underreporting, and that was true reflection of underreporting because we were not having private sector engagement fully in Pakistan. In Pakistan, private sector is a challenge. There could be a registered medical practitioner or there could be quacks. So we have to engage like maximum registered practitioner. So after that adult TB inventory study, we were able to have the PPM expansion in the country, which was a great success. And now you see, like if previously there was only few percent, like 5 to 8% reporting. After that, now recently it has gone more than 40% reporting in the country. So this is all with the policy impact. Also, similar is true for children. The inventory study, similar inventory study we did for children, and we found very high underreporting among the facilities who are not reporting, to the program. Also, the TB clinical audit, which was very interesting, and that was a basis for us to think about that how can we compare and how can we dig down data at various level, at the provincial level, even at the district level, and see that which clinical protocols are followed and how it can be, the data could be improved. Then also another landmark study I want to quote here was the TB tobacco integration within the program setting, and this was done with University of York. And this everything is published, so please go on my research gate and see the profile, so you will find these. So these research findings are directly related to the national TB policy updates and of course to the resource allocation as well. So I would like to say that research is always and should be a foundation for strategy and funding. So I'm very pleased to quote that with my work, I was able to generate the evidence and strengthen the Global Fund proposal. And also I'm very thankful to Global Fund for launching this research initiative in the country with me when I launched it for the first time, and also, of course, for securing major international funding. So I also advocated for scaling up TPT, which is the TB preventive therapy, is a challenge around the world. And because of obvious reason, there are two types of barrier. One is the patient-based barrier, one is the provider-based barrier. So we had to overcome these two. And now I'm very pleased that obviously there are obstacles when you launch a project, but after that, there are some slow progress and then there is a momentum. So now there is a, like initially they were very low progress on TPT, but now there is a momentum which I can see, and I'm hopeful that these targets would also improve in future. So any question till now, Agi?
Yes, we have one questions from Dr.
Okay.
Sakti Chauhan. It's
Yeah.
Dr. Shanti Chauhan here. I want to know how can we get enrolled in the Sort It cohort if we want to join it.
Okay. So for the sorted cohort, I will also show you slides as well. There are two possibilities. One is because, as I said, there are no finances for me. So with the minimal resources, what we can do is that this is costing, I don't know, it's 60,000 PKR for us, which is for to give meals obviously to the to the candidates who come, and little bit logistics. And this 60,000 is for whole year. So 60,000 is, I don't know, it's only, I think 200 or $300. So it is very minimal cost. So with this cost, you can secure your place. First, you need to apply. So the call is, please go on my LinkedIn profile. Agi, if you can share LinkedIn profile. So in the LinkedIn profile, there is a call that is announced now for the structured operation research training. And this is from Health Solutions International Platform, which is a firm that I have already established in the country for the sorted courses. So we have another NGO which is collaborating with us, which is the initiative. So first you apply on this call, and then we will evaluate what qualification you have already done. And if you have some of access to data, then we will select you. And there are two options. One is if you can travel to Pakistan with your own resources, you're most welcome. But once you secure your place after paying this minimal amount, then we can give you online mentorship if you cannot travel to Pakistan. So this is if you are outside Pakistan, this does not bar you from applying. So I encourage you to please apply for this course. This is live. The call is live, and 15th October is the deadline. So if Agi, you can share the LinkedIn profile, then that would be helpful.
Yes, I will share it.
Yeah,
Okay. So we have another questions, Doctor, from Maria Gia Fernandez.
yeah.
To your research, what extent can women's participation in health research change the approach to protect their family from TB, especially in low and middle income countries?
So sorry, your voice was distorted. Can you repeat the question,
Okay.
Agi?
So sorry. Uh, According to your research, what extent can women participation in health research change the approach to protect their family from tuberculosis, especially in low and middle income countries?
Oh, yes, this is a very nice question, and thank you for asking this, because like involving women is very important. So it's kind of like women can be involved at, I would say, at two stages. So one is, or in two ways. One is if you are interested to do research as a scientist, you can join, like I said, that you can join the research group and you can change the impact. This would not only improve your own understanding about tuberculosis and also brings gender equity, which would have a longer impact. The other thing is when you do researches, you keep in mind that please don't neglect women. As I said, and I will give you very interesting, I will show you picture as well, that I did a very interesting consultancy with Nai Zindagi Trust, which is the NGO in Pakistan who are the private recipient, like private sector partners for the HIV grant. And that was to assess the basic medical care for the IV drug users, intravenous drug users. And I was not expecting that I will find females on railway track sitting without any shelter, and they were there using IDUs in Pakistan, in LMIC I'm talking about. So I found them, and then I documented their finding, which was very important. Probably not many people know that you find these women and what actually we have to do. They have to dealt separately, and we have to have some shelter homes for women, because we can't say that, okay, like males, if they're staying on the railway track, we can allow females to be there, because you know the challenges and the barriers they face. So women have specific needs. We have to cater for their needs. So I would really say that it would have a longer lasting impact if you engage women, or if you assess women in your research, and also if you come up as a woman researcher. So it would have both, very high impacts in research. So is there any? Yeah,
Yeah, thank you so much, Doctor Maria
yeah,
Gia Fernandez. Hopefully, it answers your questions. If there's anything you want to clarify, please feel free to
yeah.
continue asking. So, oh, as you said, thank you, Doctor. So,
Okay.
you might continue.
Okay, thank you. I'm enjoying the interactive session. So, innovation for sustainability. Now, as I talked about, the digital health solutions is very, very important for any country, and for a country like Pakistan, and like other LMICs where there are paper-based forms, and for many years these paper-based forms were used. So I'm very pleased, and I'm proud to say that in 2017 there was a mission that was joined by the WHO, a TB Impact Management Task Force, and also the TME unit, and also from the Global Fund, who were very interested to have this, digital system in Pakistan. So that was the launch of DHIS2 in the country. And we had a lot of opportunities to budget for the hardware and software part, like in the Global Fund, regular grant, and also in the COVID-19 grant, which I mentioned. So through all these grants, I was able to put in this demand, and we were able to implement it. And now it's all over the country. So DHIS2 is there, and TB case notifications, you can monitor or track them online, real time, which was a great, great success for the country like Pakistan. So this is given as example. So for HIV as well, it is digitalized, but it's not like, it's still the specific healthcare services that are responsible for HIV. So they enter their data, and then we see the dashboard. So this is also very much helpful for us. But obviously, we have to link these two databases for this progress. The process is going on, and there is effective coordination between TB and HIV. And I'm sure in the few months after that, like, or a few years, when we get another grant, this coordination will improve, and we will have a one-stop shop solution where the TB patients and HIV patients can get care at the same facility. So I also pioneered integration of TB with NCDs, and I was the one who launched the TB and diabetes guideline in Pakistan back in 2015-16, when I was working with the union, and Dr. Lanyon was there, Lanyon. So he piloted these guidelines, and then we are also now recently, with the help of University of York, we have also started discussion for TB and diabetes guidelines. So we have already started working with TB and NCDs, not only TB and diabetes, but also obviously other, like hypertension and cardiovascular, so, and malnutrition, of course. So all these are in radar of the program, and also for me as well as a researcher. So with HIV, I've already mentioned, for HIV, we have done a lot of researches. Mental health services, there are very interesting studies that are going on, and in few months you will get very good, you will see very good publication. Some of them are published, and one of the trial for which I am also engaged is the control trial from KMU, Cyber Medical University, and I'm sure one of them have joined this webinar as well, Dr. Saima. So we are trying to make this TB and mental health services research available, like in public, once we analyze the data. So I'm sure that trial would also help for the scale up of TB and mental health services in the country. So, transforming sorry, Agi, can you mute your, sorry. So transforming challenges into opportunities like devolution, as I said, Pakistan was with the challenge of devolution, and we like TB was as vertical program, HIV was vertical program, and then now there is more integrated approach that is more encouraged by the provinces as well and the for the federal level as well. So this required multiple advocacy with political leaders and policymakers. And when I was there in the program, I already started, and now with my this new role, I'm trying my best to have this integration at every level. And we are trying to transform these challenges, and because I know the challenges that are already there. So it's just that transforming these challenges into opportunities. So we have continued journey for this as well. And things will more get better with the passage of time because obviously more work has been done. So now we have a foundation to follow. One of my achievements, which is a lifetime achievement award for me from the union, was Union Medal in 2024, and this is the highest prestigious award that is given to anyone who has done remarkable efforts for TB control and also research and advocacy. And I'm very humbled and I'm very thankful to the International Union Against TB and Lung Disease to award me this medal. So you can see the union website. You could just type the Union Medal 2024 and you will get the details. And this is on the right side is the picture and this is the medal. Also, from January, I have my own consultant firm, which is the Health Solutions International. So this is the page that I have tried to tag. So I will also send this detail to Agi. And if you want to see, if you want to engage this platform in further research or further project, I'm always available to guide you. So these both are like a high achievement for me in Pakistan to think about, okay, I have achieved something in the country. And again, I'm very thankful to TDR Global News. You see, this is my profile, and which Agi must have shared this as well. So you read the caption, which is Champion for Operational Research to End TB in Pakistan. So I'm very humbled again to TDR. As I said, that I had enjoyed a lot of support from my colleagues, from Professor Tony Harris, who was mentor for me, and I launched this initiative sorted for the country, and also Dr. Ronnie Zakaria, who is from TDR, and everyone helped us to have this momentum going on for launching sorted in the country, and now. The call is live, so you can see the details in the LinkedIn. Okay, so building mentorship network for the future women scientists is very important. And obviously, I have been doing this with the Sorted Initiative as well, and with the Center for Impact, and also with many other initiatives with University of York. So we had a lot of very good ties with the young researchers. So I'm very open and available for anyone who wants guidance to pursue their career as researchers in the country. So I always advocated for women in inclusion, women's inclusion in TB research, clinical trial as well, and health leadership. So many trials are currently pipelines for which I'm the TSC member, which is the trial steering committee and many other things. So this picture, now I will show you some pictures. So in the meantime, you can stop me, Agi, if there is some question so we can discuss. So this is the picture from Sorted, which I attended, and you can see me here on the left side, left corner. So this was in 2010 when I attended this course in Paris, and I was able to publish my first ever international publication, which is the title is given below, Comprehensiveness of Primary Services in the Care of Infectious Tuberculosis Patients in Rawalpindi. So this was very interesting study, and from that I learned that through simple methods, comparing registers and comparing the sources of data, we can have very good operational researches and we can publish them. So this was again, this was with the support of my mentors from the WHO TDR and the union. And this is the sorted cycle which I was talking about. So this sorted cycle explains everything. We start, number one is the research. So once the candidate is selected, we ask him to come with us for 2 weeks initially, either online or in person. So first is the research protocol writing. That is, we teach them how to write research protocol on the similar to the standard of international protocol writing, which is given by the WHO TDR. And then after 7 days, the same candidate is given training for the module 2, which is data analysis and also data entry. We usually use API data, or we also can use data for analysis. So, and after that, we give them milestones. So this is not a course that can be attended by anyone like other workshops. And at the end of 4 or 5 days, you get the certificate. We teach them, and then we tell them some milestones to achieve. Like we ask them to submit dummy data tables, to submit high quality protocols. Everything when it's completed till milestone 3. There are 3 milestones, and they are like different milestones, like protocol, like data analysis sheet, quest rec check files, and at the end, dummy table. So once we receive everything, then we decide that, okay, this candidate is eligible for module 3, which is the final module for the manuscript writing. And once, if the person or the candidate fails any of these milestones, then we have to say goodbye. So this is a very product oriented and output oriented course. And then after that, in the manuscript submission, like we train them till the manuscript submission to the international peer review journal. And in this way, we guide them how to publish their research in the international peer review journal. So this is whole sorted cycle. And at the end, you get a beautiful certificate, which is signed by WTDR and me. So this certificate has a lot of value, and many sorted candidates in the country, they were able to get admissions in PhD, and they were able to secure fellowships internationally. So this is a very useful sorted course for you. So I really encourage anyone who is interested, please get back to me, send me email, and see the LinkedIn profile for the call, which is live. So you see, this is the, you can clearly see that when 2015, when there was no sorted, and then we launched in 2016, there was an increased steep rise in the number of publications, and it is showing only 55, but right now it's more than 100. So this is the journey till COVID. So after COVID as well, we continued the momentum. Okay, so these are some pictures. These are last few slides where you see this was on the left side where you see a building, and I'm standing outside the building was my rural health center. So when I joined that rural health center, there was no boundary wall even, and there were some animals that were roaming around. So it was pure rural area. And then with the help of district health officer and all my donor support and my colleagues, I was able to have this built these boundaries and also declare this as a model TB dot center in Rawalpindi, which is a big district in Pakistan. And you see, starting from here, and now I'm enjoying discussions at the international level. So this, I really, when I look back, I really feel proud for all the journey. And this, the Chinese person in this picture is our WWR, Dr. Lord Peng, right now. So there was a very interesting meeting with him as well. So he's very supportive for all these research initiative. And then on the left, and this was the World AIDS Day in December 2023, where we also discussed how to engage community, and we have very good organizations here, and I think many of them must have joined this webinar as well. And these organizations are working with the community, and I'm very pleased to see their work. So HIV is also a field that you should choose to do research, and any guidance you need, we can guide you, we can link you with the relevant people, and you can pursue your research in HIV. And on the right side, this was my office as national coordinator. This was the day when I joined, and the lady in purple is Dr. Bushra, who was my mentor, and she was also in CMU for a short time. And also the lady in yellow she's in the Merit HIV, she's head of the Merit HIV group, and she's also having a lot of good trainings for HIV and training material. So if you need any help in that HIV training material, I can link you with her as well. So here on the left side, this is the railway track that I was talking about, and I was there to assess all these intravenous drug users, and I found females as well who were lying in the open air in that railway track. So this is, you see, this is your passion, that you don't confine yourself to your office, You go in the field and you see practically what is going on. This is the public health and this is research. On the right side in the yellow shirt is my son. So he was with me when I got this medal in Bali. And also, you see Guy Mark, who is president of the union, and also my husband in the broadband. So I'm very thankful to all my colleagues and all my family for all the journey I had. This was a medal, and this is my office when I was chief research and surveillance. So I have a lot of emotional affiliation with my office, and that's why I feel pride if something good happens in tuberculosis control in Pakistan, and I really want to see some very good progress for TB in the country. And this is that's why, for 16 years, when you remain somewhere, you have an emotional affiliation. So this is how I'm very much emotionally affiliated with tuberculosis. So now, summarizing for all of you, barriers towards success. If you underestimate yourself and you don't realize your potentials, I think this is a big barrier. You need to critically analyze yourself and you need to see what you have done well and where you have not done well. And then after this analysis, you go ahead with your mission. And in that way, you will be successful. So I have learned many lessons in my life. They were very, very helpful for me to shape me better and to perform me better. So you need to stay focused with the high aims in life. You should always aim for the moon. Even if you miss, you will land among the stars. And this is very true. And for all this story that I have told you, I really saw this that when I was aiming high, I was able to achieve at least close to my highest target. So if I aim lower, then I will not be able to achieve that target, right? So if you're afraid of leg pulling, so this is another lesson for you. Please, if you see leg pulling around you, this is a positive indication that you're doing something. So please don't be afraid. If you see leg pulling around you, you must have done something right. That's why some people are jealous. So jealousy is very, very normal. Take it as a positive note for yourself and try to improve yourself. Try to learn lessons and move ahead. So this is the summary of key to success. Number one, as I said, identify your strengths and weaknesses, a critical appraisal about yourself, learn from your mistakes and try to do best to improve yourself. And also you need to transform challenges. As I told you, there were challenges, there were funding freeze, there were funding cuts, there were workforce challenges, but you need to transform all those challenges into opportunities. And when you think about transforming, then I think this is a positive road to success. Be brave and don't give up in difficult circumstances. Difficulties are everywhere. And first step when you take this in right direction, your way would be easier. So you don't have to give up, continue your journey and never stop learning. This is very, very important. Never think that you're very learned and you have achieved everything in your life. Life is a continuous process of learning. So never stop learning from your mentors and always respect them. This is my last slide. And this one is very interesting publication. I would encourage all of you to see, where you will find a lot of interesting things about the women researchers as well and about the policy changing, which policy changes that were done in all my journey. And I'm again very thankful to all my colleagues who helped me, all the mentors who guided me, all my family members. And I think we never stop learning and you never give up. This is my last slide. Thank you very much.
Thank you very much, Dr. Razia Fatima. Well, it's almost 9 p.m. or 7 p.m. in Pakistan time. We
Yeah.
have a really great presentation, but one last questions. We have questions from Maria, our very own from our very own Center for Tropical Medicine UGM. Would you mind sharing what's your first grant experience was like and the challenges you faced in securing funding early in your career? Any tips for women researchers that just in their early career?
Yeah. So as I mentioned, like all the tips I've already given in the slides, but I will try to again summarize that like challenge as a woman researcher, as I said in LMIC in Pakistan, I've given you example that when I started talking about research in the country, I was having raised eyebrows from everywhere. Okay, research, what is this research? Like this is a project-oriented culture, which is usually done in various institutions. So when you talk about research, it's a different thing. You talk about clinical trials, you talk about sample size, you talk about some scientific methods. So people are not very much, like I remember for the prevalence survey discussions, I used to like feel like this, that some people were not interested or some were getting bored. So one is that you have to create this interest. So for creating interest, you have to have adequate knowledge with you. So if you're not with the adequate knowledge, and if you're not have done search or literature search from yourself, this could be taken as a negative effect. So you have to equip yourself, equip your mind with the right information. Then you go talk with the funders. As I said, that when I launched this sorted in the country, this was like a new concept. And this was taken like, okay, this is an ordinary training, but this was not an ordinary training, as I've shown you. This was with the product oriented approach, with the outcome oriented approach. So this would be like my advice, that whatever you do, you have to master yourself in that. So if you're doing some clinical trial, read it carefully, read it like so that you can do very well in front of the audience that you want to convince. So, like if I talk about sorted, I have to know it very well from my side. Okay, what are the benefits? Then you should have a convincing power to the person you're talking to. So the convincing power comes with, like, you should be able to logically change their mind, because they have their mindsets. Probably they will say, okay, this is the ordinary training, so there is no impact. But there is an impact which is internationally published. And like in any clinical trial or in any operational research, this is not only for sorted, but all the other research products. You have to have a clear knowledge about what you want to do, and then you have to convince. And this I have seen that although funding freeze is a problem right now, but once you have your target in front of you, and you can convince donors, or you can convince your colleagues who are willing to support you, this will not prevent you from the barriers of these financial cuts and everything. So don't think about, I would say, that money in your mind. Okay, there's no resources, I can't do anything. Money is a secondary thing, resources are the secondary thing. Once you decide about and you have a passion and motivation to make a difference, then you can make a difference. And plus, you should feel from your heart. As I said, that for TB, I was feeling everything from my heart, that okay, I want to do this, and I want to make some changes, make some differences, and generate some evidence. So this is how, like, it should come from your heart. Should not be an artificial, or it should not pretend like it's you're doing for resources. So once you bring that passion in you, then everything becomes easier for you. And as I've shown you all the slides as my journey. So as a woman researcher, I already told you challenges that once you come as a woman researcher, it's not very easy task. So prepare yourself for the challenges. But at the end, if you stay focused, there is a perseverance and there is a resilience. At the end, you will get a good outcome in the form of all the stories that I've shared. I hope I answered your question. Yes, are there any other questions?
There is one last question from Dr. Shanti Chauhan. Dear ma'am, I wanted to ask another question. Is it that people are interested in pursuing a PhD program focusing on tuberculosis? Can you please guide us in that, as a major issue I have been facing is finding the supervisor? Perhaps this is more of a generalized question and not very specific, but guidance is needed.
So this depends upon in which university you're applying, Dr. Shanti. So if you're applying for a university, I think you need to, like, you must have choice in your mind, that when you apply for a university, then you see the faculty members there in the university. And if you get the expertise, like as I told you, let me tell you that when I applied for University of Bergen, so I was lucky enough to get my supervisor who was already interested and who was already trained in tuberculosis. His name is Sven Gudmund Hindereker. So I was able to have him as supervisor. So you need to really search for which faculty are already there in the facility, in the university, and then you have to request them for their interest. So if they are already working for tuberculosis, definitely they will help you. But depends on your topic as well and your data access as well. So I don't know if it is a general question or specific question, but if you have some specific question, you can write me an email and I can respond it to you. But generally, this is a concept that once you have a proposal in your mind, then you apply for PhD and then you seek for the supervisor. And there are many supervisors who are interested in tuberculosis because it's a big problem, in the whole world, not only Pakistan. So I'm sure you'll get supervisor from the university which you're trying to search.
Okay, so thank you very much, Dr. Razia Fatima. Unfortunately, it's the end of our session as we have spent 1 hour already. Time flew by so fast. Yeah, yeah.
Yeah, so
Thank you
I
very
really
much, Dr.
enjoyed. Yeah,
Yeah,
thank you very much. I really enjoyed the session and good luck to everyone who is
yeah.
pursuing PhD or a good career in public health. Good luck.
There's also some of our participants in the comment that says thank you to you from Rabia. Thank you, Dr. Razia. It's very informative and motivational. And Kuratulain Isan also said very informative session. So thank you very much, Doctor, for
Thank you. Thank you,
tonight.
Agi. It was very nice. Very nice
Uh,
to meet you and everyone. Okay.
yeah,
Bye
so
bye.
bye. So as this is the end of our session, everyone, perhaps we might take a few good pictures
Oh,
for
yeah.
documentation to commemorate the
Right.
day.
Sure,
Please,
sure.
everyone, kindly open your camera and we can start by documenting. I ask the team to help us in screenshotting. Thank you, everyone. Also, in one, two, three, cheers. Okay. Again, everyone. One, two, three. Give it your best smile. Thank you so much,
Thank you so much. Do
everyone.
share the picture as well.
Yeah.
Okay.
It's an honorable day for us to have you here, Dr. Razia. Also,
Thank
thank
you.
you
My
so
pleasure.
much for all
My
the
pleasure.
participants. And as we're already in the night for some of us, in the GMT plus 8 and GMT plus 9, we perhaps this is goodbye for now, but next month, we'll see if we have more webinar coming in. So everyone, please, if you would like to know more about TDR Global Asia, you can please follow our X on x.com TDR Global Asia or join our newsletter. It's in your screen. You might screenshot it and just scan the QR on your phone later. And I'm Agitiara, your host from TDR Global Asia. We thank you for participating in today's session. Have a good night, everyone. Have a good rest. See you. Keep breaking barriers. Thank you very much.
Bye. Thank you.
Bye.